my pleasure to introduce to you our next speaker this morning. We're next going to hear from America Bracho, the President and CEO of Latino Health Access, a center for health promotion and disease prevention that empowers community members and health workers to become leaders of wellness and change. Before coming to the United States, Bracho worked as a physician in her native Venezuela. She's been featured in several documentaries, including HBO's The Weight of the Nation and a TED-Med talk about patients' roles in improving healthcare and their communities. Please join me in welcoming America Bracho.
Thank you so much. Oh, there we go. Okay, good morning. Thank you so much for inviting me to your beautiful state and your great conference. So far, so good. So far, so good. It's really, every time I come, particularly to a place like this, particularly with a group like you, I feel I am in a support group. And certainly, you know, I will leave this conference thinking that I'm stronger because I know you are here. And I appreciate that a lot. I appreciate the words of my previous colleagues because it gives context to everything I'm going to say, but also it warms my heart. And probably because we have been working very hard in my organization to challenge the dominant paradigm that says that this is the way you do business. This is what you should care about. If you want to succeed in this world, in the nonprofit, you know, no money, no mission. And maybe, you know, it's true, but the money, where the money comes from, it doesn't have to be that source. We become very dependent on the big players so they can give us money so we can work with communities that are low income. And we end up thinking that success looks like what they are doing. And we end up thinking that if powerful organizations and powerful institutions get together to figure out the solutions, we are going to solve the puzzle. It doesn't matter that the community living those circumstances are excluded. So when I come to places like this, it allows me to reaffirm that that is not the paradigm I'm following. It's not. And as I can understand, I can cooperate, I can see it, I can find common ground. But that is not the paradigm I'm operating from. So it is oxygen to my lungs. So thank you so much. So like in any support group, I might say I'm America and I am Venezuelan. You know? I am America and I am a Latina. I am a mom and I care deeply about this agenda. And this is a very personal fight. And it's a personal fight because if it's not personal, I cannot have any commitment. The professional brainy side of me is brainy. My passion is in my heart, and my heart needs to be in this fight. I went to medical school in Venezuela, which is, you know, similar in many ways to medical schools everywhere. And they tell you that you have to leave your personal out every time you do this type of work. Any work, you need to leave the personal out. And probably you have heard that, right? The personal and the professional are two different things. And this afternoon in my workshop, we are going to work a little bit on that, on how to make sure that your personal is in. I used to ask my professors, would you please tell me where do I leave my personal? If you want it out, is there a particular place like a cubby, a locker, something where I can go back after I work here and get it back with me? And is it possible? Is like your recycling bin outside, go here to get your personal? So I don't know what they mean, or I do. I do that this is something where you have to be heartless so you can make the right decisions. You know what? No. I don't endorse that. It's not my paradigm. You don't bring your heart, you don't bring your passion. So go back to your cubby and get it. We need to get it, and we need to bring it in. I'm going to tell you a little bit about some of the work we do, and I'm going to skip on some of the slides that are that could repeat some of the concepts that we have heard. For example, that as a principle of practice, my organization has principles of practice that were developed throughout 23 years and that guide us. And we need principles of practice, so when we are not doing the things we say we want to do, they can bring us back. Because unfortunately, we grew up in this society, and many times we say we believe in A, but we do B, because B is what this society put in our head. So we need to review this, and I need to go back and say, okay, this is not about glucose, right? But I could have a diabetes management program. But what happened when the people in my diabetes program don't have anything to eat but tortillas? Do I just say, I don't do that? I don't do windows or ovens? I only do hemoglobin A1C? So this is a good refresher when in doubt, right? Just to understand that in the Declaration of Health, that is more than the definition, the World Health Organization and people like you and I that were there when they wrote that, talk about the commitments to concepts of equity, solidarity, social justice, incorporation of gender perspective, and for sure, the commitment to people that are suffering the most. And that is a very important concept for us when we think about equity. This is not equality, and we will discuss that a little bit. You know, my commitment is not to serve forever the people that are millionaires in Orange County, California, so they can live even better. It's not. To tell you the truth, it's not. That I care about everybody is true. That I live in a beautiful house, in a beautiful neighborhood, that is true too. But my work, my daily work is not to do that. I am clearly and in a very biased way committed to the people that are the most vulnerable. The ones that live in those places where these disparities are happening. These disparities are not happening in the nation. They are happening in those places. Exactly in those places. So when people say, let's invest in this national thing, I'm very glad. But I fight to have more investment in those places, because that's where the disparities are concentrated. And you saw a slide similar to this one. I'm going to use this one to explain more what I mean. So pretty much these are our services right here. Our diabetes management services, our cancer prevention projects, those are in those apples in that side. And you can see that there are people that can get them and then people that cannot. The services are there. So this is the equality concept. We have to have the same budget for the families in Newport Beach, Laguna Beach, Santa Ana, Anaheim, and all the zip codes. You know, $8 for you, $8 for me. In the equity mode, you want everybody to have access to those services. But do we know how? I don't know. I don't know that we know how. And for sure, what was said previously about our own idea that just by giving a bus pass we solve the equity puzzle, might be like the easy next upstream, but it's not going to get there. My challenge, my invitation to you and to myself and to my own organization is the ongoing research on what goes into these boxes. And that is not the same for Maria than to John. It's not the same. So for Maria, what goes in that box might be support, might be a network. If she's an immigrant that is suffering of depression, maybe she doesn't need Prozac. Maybe she needs a network. Maybe she needs to know where are other things, and she needs you. Against a paradigm that says that if you are there for her, you are enabling her. And that is the dominant paradigm, the one that says, you know, I'm going to give her instructions, but I'm not going to enable her. Enable means go with her, be with her, talk to her, advocate with her. So what enable means? So enable is a word that we need to deconstruct because it has become pretty oppressive in our communities. So in the challenges of this equity, I think that we need to work on both. We need services for everybody, and we need to intensify the efforts in underserved areas that have been affected and neglected chronically. So I do believe that both need to happen. But then, in the equity side, you hear comments like, why? Why am I going to intensify resources in that immigrant community? You should just go back to their country. Why am I going to use resources with those Latinos that are immigrants? And that is a position. That is a paradigm. It's real. It's here. We hear every day and we feel it every day. So, the people that think like that are not going to invest more in those communities. So it's up to us to do this ongoing investment, not just in having resources from the city and the county invested there, but having the people of those communities step up to the plate and create mechanisms for the community to speak their voice. Because this community is the sector that is excluded. When we think about communities and collaboration, we think about the school and the hospitals, the religious sectors and whatever sector, and the government. But Maria and Pedro, who live the data, they live the data every day, are not at the table. The people at the table are the people that collect the data. And that is not right. It's not right even from the scientific point of view. Because you collect the data, somehow you become an expert on them. Now you are expert on me. Can you tell me about me? I would love to hear how I can get a better life. Since you are doing the thinking, would you please help me? Or would you please open your table? No, I won't open my table. But you won't open your table because you think I cannot think. Because I'm not a thinking person? Why you are not inviting me to think? What are your assumptions? That because I have a third grade and I make tamales, I cannot think? But guess what? That kid that you are trying to serve is my kid. And he's one of your numbers, but I live with him. And if someone can influence the life of Pedrito, it's me, because I'm his mom. So it is smart to include me. And not only that, as a single mom, I can tell you how I deal with school and food and disease and everything. I know how to be comprehensive. I'm not fragmented. So you need me. You need me so I can guide you on how to become less fragmented. So here is one slide on disparities. You can research this, you can find out. I'm not going to bore you with that. I chose this because when you hear about disparities, you see things like, Latino children, a lot of obesity. And then the idea here is to say, where is that happening? Not all obesity is created equal. It is like HIV. The general information can tell you that the level of prevention has increased nationally. Nationally, that is true. But we have epicenters of HIV infection among communities of color, and females in particular. So again, because the national data is not helping us see the local data, the place-based data, the data that we need to demonstrate that not everything is equal here. So we go to the place, and we work in the place, and we participate in national forums and national agendas, and we will join the fight of Colorado, and we are joining the international fight, but we are at the local base. Because at the end of the day, if our community members do not participate, things are not going to change. And the day we change jobs, that's it. The day our grant finish, like they say in my community, it might be your grant, but your grant is my kids. Your project is my house. Your budget is my housing. So it's different. I live there. You work there. So I hear that loud and clear. I don't live in that neighborhood. I live in another neighborhood. America, you are privileged. Open your mind. And careful, America, because you live in another place. And like Paulo Freire used to say, consciousness is increased in the presence of contradiction. When you live in that privileged neighborhood and you come to Santa Ana, your consciousness expands. If you just stay in your neighborhood, you forget. You forget. So we believe that places are critical for our projects. And we also believe, as you read about healthy communities, there are many things that influence, that can help us create healthier communities. And those are the three main ones that people that know about healthy communities say in the literature. We need data, we need community engagement, and we need intersector collaboration. But we need data about the place. We need community engagement for real. For real. It's not a community engagement that, okay, this community answered a survey. That's the extent of my community engagement. The detail, let's talk about the detail. This is my data. No, this is the data from where? This is community engagement. In what way are they being engaged? Are they at your table? Are they helping you analyzing the data? Are they your co-workers? Are we hiring them? Are we sharing power? Are we sharing money? Or we are the ones getting the grants. We are the ones getting the job. And the community is out there as volunteers? Or is that because my university doesn't allow us to hire community members unless they have a college degree? Okay, so you already have a design of exclusion. What do we do with that? Again, this is a support group, right? So I'm also sharing what is in my heart, what burdens my heart, about the many designs that are keeping us from doing what we really want to do, but working in institutions that have these horrendous paradigms that exclude people. And then the intersector collaboration, and we are hearing about collective impact, but I'm telling you, my friends, this world is designed to avoid collaboration. Avoid collaboration. Not only collaborating has this obligation to be nice and smile, and some people can't do that. Some people are really mean. Some people tell you horrible things. Some people are just about them. But here we have to sit down and collaborate. And it's true that we have to do it. That takes a lot of also personal work and institutional work. This is another mind. We forgot how to collaborate. It was easy before where you needed to have like 20 people to kill a buffalo, right? You didn't have a choice. Well, now you just go to a supermarket. You don't need anyone to kill the buffalo. But we need everyone to create healthier communities. So again, a little bit about the data. And this is a presentation that you will have in you have access to this presentation. We are talking about data. Tell me what you are talking about. Like when people say, I love you what? What do you mean with love me? How that love will walk? You love me because what? You come and have sex with me for 30 seconds? Do you love me? Is that love? Okay, so tell me about love. Tell me about money and partnership and help. Tell me about love, right? So tell me about data. It's about the places more affected. Well, America, why are you going to do only that among Latinos? And why your organization is called Latino Health Access? Well, guess what? Because when you fight for equity, you have to focus. So otherwise, you become, again, you work on equity. So we are not health access. We are about equity. And we need clear commitment and clear activation. So we also need data about the strengths and aspirations of the people. So again, I look at me and say, well, do we believe that? Do we believe that actually people have it? Let's document that. It's not just disease data, like Karen was sharing this morning. It's not just disease data. And again, it's data documenting disparities. So this is Orange County, California, where Disneyland is, where Knott's Berry Farm is, where Newport Beach is, where Baywatch was taped. I don't know where they got those people to tape that, but so this is Orange County from Buena Park to San Clemente. And the dark area is where Santa Ana is. So if you see that, in terms of data, we were part of the group putting together this report. This is where obesity is concentrated. And I'm going to play with one example. I can do 2 zillion examples, but I'm going to focus on this one. This is where obesity is happening in huge numbers. But of course, it's happening in other places, but not in those numbers. That happens to be the dark blue area in the middle. is where the Latino youth is. So Latino youth, obesity, very simple, very graphic, right? And that's also, where you overlay obesity and poverty. Right there, you see Santa Ana right there. And then, let's go to the neighborhood. Let's go to the neighborhood. This is where people live. So, my dear friends from those neighborhoods tell me that they have to pay $50 fine if the kids are found playing outside. And they are asked to sign that they commit themselves not to let their kids play outside. So kids trespass. They play in dumpsters or they trespass schools that are closed. They cannot access. And then this is the neighborhood. Did you put this in the morning and they put this in the afternoon? And this is the neighborhood, full of liquor stores. So adults with a high school diploma, less than 50%. We know that education influences health outcomes. You need to work 126 hours per week at minimum salary to afford a one-bedroom apartment. 126 hours per week. But if you leave your son alone, social services will come and get him. And you are going to be neglectful because you were working and he was alone, taking care of the other kid, and this gets very complicated. We are the nannies of the entire county, where our kids are alone. So we try to fight this, and with this principle, nothing about us without us. Nothing about us without us. So we include the community and even the young people because they know what they need, they live there. So we rethink, who are the experts and how do we include them? Again, they leave the data, they are researchers, they advocate. So the community is very important. Latino Health Access has 65 employees. 42 of them are community workers that are paid full-time. And they are community members, promotores, that live in those communities, where these are their neighbors. 42 members of the community we serve are my coworkers. And they make me accountable every single day. They outreach, they create spaces where they can create deeper relationships. This is not about transactions, this is about relationships. And they provide services and they create mechanisms for participation. So we do outreach because we need to find people. We have the obligation to find people. This is our Healthy Weight program. Of course we do the knowledge part. Of course we do the training. Of course we do the service. We have a great program. But a kid that is 200 pounds after the program is 185 pounds. And what do we do next? We give them a diploma. So we have to. This is a community that when we started didn't have a single park for an entire zip code. An entire zip code. You come here to Colorado, you won't believe that, right? But this is how urban America, how those places sometimes look. So this is like an idea. How do we do something immediately? Well, this is a parking lot where we can have like a gym twice a week. But we decided that we wanted to go beyond that. We started taking back our streets and walking our streets and assessing what was happening there, and we started getting organized to create a park. And the community, just the people, the regular people said, we need a park, the kids are being killed, the pedestrian injury is horrendous. So how do we do that? And we started partnering, organizing, trying to get funds. We identified a lot. This was a very long story how to get that. And it took 11 years to get a park that is 0.5 acre. 11 years. Well, that's the bad news. The good news is that we have the park. We have the park, and we have the hope. This is what we call, and we just published our book of Latino Health Access, but this is what we call a hope Energy Action Project. It's a project where people can get involved and will start believing again that change is possible. Not because we lecture them, but because they are there in the middle of the change. They are doing it. They are feeling the consequences. So in Healthy Cities, we say that there are 5 stages. 5 stages in building healthy cities. Stage 1, you do health education, you do services. Stage 2, again, you just have more services. And all of that is important. But if we want to create healthy cities, we need to move to stage 3, in which we have a lot of community involvement. And it's the community in a protagonistic role. It's not the community helping you. It's the community with you. It's not increasing participation of them. It's participating with them. It's not targeting the community. It's partnering with them. So it's a different paradigm altogether. And in stage 4, we do the policy jump, because without changing policies, things are going to be short-term. And we need to invest in the long term. Stage 5 is when those health policies are part of your cities, your counties. So we created a policy department in Latino Health Access to go into that route. And we do outreach and engagement, we do civic education, and of course, for us, organizing the Latino vote is a health strategy. And collaboration is the 3rd leg of Healthy Cities: data, community engagement, and collaboration. And we have to do it, and we do it. It's through collaboration that we were able to create this wellness corridor in downtown Santa Ana, where now we are talking more about safety and the built environment, and working with the city, the government, the business sector, the many, many sectors. We were able to create this, which is the Santa Ana Active Coalition, and now people are biking, and we have a bike route, and these are important changes that we will be moving into the general plan of the city. And we also have been able to create the urban gardens, and they are, the leaders of the urban gardens are Latinos that have been farm workers, you know, and they bring the wisdom. We don't need anyone else. We have the experts. We know how to sell in a market. We know how to grow food. We know how to do this. And we partner with people like Northgate Markets, which is a large market chain. They have their own health program. They gave us part of the land of the park. And without them and the local hospitals, we wouldn't be able to do all of the things that we are doing. But we organize the community to go to Sacramento. They need to know the representatives. They need to know that even if you don't speak English, you can talk to your senator, because it is your right. And we have to talk about our rights, because we have rights. We are not just clients of some organization. We are individuals that want to own this, that want to have the power, and we do have the power. I tell people we're afraid of the word power, but power is translated in Spanish as I can. Can is power. That's the translation. And we can have communities where our kids can grow protected and be successful. We can do that. That is power. Power is not just the traditional concept of power that is corrupt and fraud. That is just one type of power. So we fight to change this. You know, the warning labels on sodas, and to tax sodas, and you know, and we joined the national fight with many groups. And we organized to change the strategic plan in the city. And we are getting there. We got the city to approve giving us a lot to do more urban farms, to create a market, to do, you know, we are fighting for housing, for decent housing, because the connection, not because I see the connection, but because the community works with me. And they cannot afford houses, not even with the salary that we pay. So the design of my organization is so we don't forget that you need 2 accountability departments, one that accounts for the money and one that accounts for the mission. Because we forget, my friends. So some lessons to share. Transforming our community requires true collaborations, nothing that you don't know. The strength of the collaborative will create the power base for change. This is not about just sitting with you. This is about becoming more powerful, because we need to change a system that is pretty powerful. Nurturing and preserving the collaborative is critical. So we cannot talk about collective action, collective outcomes, without having a mechanism to preserve the collaborative. Collective decision-making takes time, trust, and effort. And the trust is crucial. Otherwise, you will be engaging in transactions. In order for you to influence me, or for America to influence you, we need trust. And trust doesn't happen when you buy half a pound of cheese and you get the cheese and you pay. That is a transaction. You have trust when I have been there for you, you have been there for me. I walk with you. I am here. And then the final one, we have many ones, but I chose these ones, is that success is collective. When you work on collective outcomes, success is collective. And there are people that have problems with that because everything is about their organization claiming the success. And in collective outcomes, if we make this, when we are making, and we are making it, it's not going to happen in the future, we are making communities healthier. Who can claim that this is their success? So just being used to saying the credit is collective and is for the collective benefits. So today I'm proud to join your efforts and your movement as you join other movements with other sectors. And I'm ready to tell you that the success is going to be collective, that we are getting there, and that we need to open our minds and our hearts and work with them together to make sure that the day we reach a point that we can be proud of, or more proud of, that we can be super happy to say it was the collective, not just me. Thank you so much.